News tonight a bit alarming. According to the Tennessee Hospital Association, almost half of Tennessee hospitals are at risk of being closed down, and it's hitting rural communities the hardest.
As News 2's Adam Mincer shows us, that makes it harder for many Tennesseans to get reliable access to important health care, like having a doctor in the room while giving birth.
For expecting mothers in rural Tennessee, it's a coin flip if the hospital closest to them is equipped to deliver their baby. Dr. Harrell works at one of the few exceptions.
When I moved to this county, there were 2 hospitals that delivered babies. Now there's 1. Another county, 2 counties away, has no unit that delivered babies, but there was one there a few years ago.
According to a new report by the Center for Healthcare Quality and Payment Reform, 24 of the 52 rural hospitals in the state don't provide labor and delivery services.
Make women have to bypass a hospital setting in front of them when they're in labor, perhaps, to go on an hour or hour and a half or 2-hour long car ride to get there.
A lack of obstetric care impacts more than deliveries. Harrell says he's had patients he had hoped to see every week, but instead only saw once every 3 months.
They don't have, in many cases, the gas money to do that, the means to do that, even a reliable car.
It's part of a larger trend of rural hospitals shutting down across the state. According to the Tennessee Hospital Association, 13 have closed in the state since 2010, the second highest rate in the country. Judy Roatman with the Tennessee Healthcare Campaign tracks this data closely.
Closure of the rural hospital puts a tremendous strain on the emergency response. The ambulance becomes the emergency room.
She says the numbers are showing no signs of declining.
That the hospitals are drowning under the weight of uncompensated care.
And that, combined with the frequency of lawsuits against OBs, means often women's health care is the first thing to go when money is tight.
They go to the ER with a problem, but they can't consult an expert in pregnancy or women's care, and so important diagnoses get missed.
According to the Center for Healthcare Quality and Payment Reform, 14 rural hospitals in Tennessee are at risk of closing right now. It's worth noting, experts say these closures put a strain on urban hospitals too, making them in higher demand with people traveling hours to seek care, often without insurance. Haley?